Welcome to Prince Sultan Cardiac Center, where your voice matters. Last October 5 to 25, 2020, the nursing department of PSCC embarked on an exciting journey that is the first ever NDNQI-RN survey, which allows nurses to be heard and be movers for change. This survey is also one of the first steps in our preparation for our magnet journey. We would like to take this opportunity to thank all of the nurses who have participated in the survey, as well as the nursing managers and nursing administration staff for their efforts in educating and encouraging nurses to participate in the survey. In partaking in this survey, all your response was directly sent to Press Ganey and were kept confidential and anonymous. Now, the nursing department has received the RN survey report. The results are in. In this video, we will tackle how to interpret the report and use this data to make improvements through creation of an action plan. The RN survey report is divided into different categories, reflecting nurses' job satisfaction, safety of the working environment, quality of care provided to patients, and magnet-related questions. Each question in the survey is scored and is grouped into categories. As the staff answers the questions related to that category, we can get the overall score. Each category is scaled differently. Some are scaled from 1 to 4, others from scale of 1 to 6, some also by percentage. And always remember, the higher the score, the better the rating. So let's move on to the different categories measured in this survey. First up is the Nursing Foundation for Quality of Care. It refers to a nursing model of care and nurses' clinical competence and development. This is to check the availability of programs for continued education, programs for newly hired staff, and if the nurses are using nursing care plans to facilitate standardized holistic nursing care. Example, working with nurses who are clinically competent. Staffing and resource adequacy. It shows if the unit has adequate staff and support resources to provide quality patient care. It reflects whether the unit is understaffed or has adequate supportive services that allows nurses to spend time with the patients. Sample question for this is, does the unit have enough staff to get the work done? Next is the task. It assesses the activities that must be done as a regular part of the nurse's job. It also assesses the satisfaction of the nursing care provided in the unit. Example, nurses have sufficient time for direct patient care. RN to RN interactions. It assesses the teamwork amongst nurses in the unit, the formal and informal contact between nurses during working hours. Example, nursing personnel pitch in and help each other when things get in a rush. RN to MD interactions. It assesses the interaction between nurses and doctors, formal and informal contact with doctors during working hours. Example, doctors respect the skill and knowledge of the nursing staff. Decision making. It assesses the nurse's freedom and involvement in the decision-making process related to their work. Example, management of policies and practices related to decision making. Autonomy. It assesses the amount of independence, initiative, and freedom permitted to nurses in daily work activities. Example, nurses are free to adjust their daily practice to fit patients' needs. Professional status. It assesses the importance or significance of the nursing job. It reflects the satisfaction of the nurses of their status in the unit. Example, nurses' work contributes to a sense of personal achievement. Pay. It assesses nursing satisfaction with their salary. Professional development opportunity. It assesses if the nurses have the opportunity and access to career development, which provides support for pursuing degrees in nursing. Professional development access. It will assess if the nurses have opportunity and access to career development. For example, nurses have access to regular in-service programs. Nursing management. It assesses the staff satisfaction with their unit managers in relation to decision, support, and consultation. Example, the unit nurse manager backs up the nursing staff in decision making even in conflicts with doctors. Nursing administration. It assesses the visibility and power of the chief nursing officer, which is the director of nursing. Example, staff nurses perceive the CNO as equal in power to other top-level hospital executives. Job enjoyment. It assesses the degree and satisfaction to which nurses like their work. Example, nurses are fairly well satisfied with their job. Missed care. It assesses the number of care types that were left undone by nursing staff. Example, skincare, oral care, administration of oral feeding on time, and other nursing care. Safe patient handling and mobility scale. It assesses the availability, readiness, and quality of SPHM technology as well as the nurse's knowledge and competence in using the technology. Example, use of transfer device. Interprofessional scale roll-up. It assesses the working relationship of nurses and other healthcare workers such as doctors, pharmacists, other nurses, therapists, and social workers. Nurse's job plan. It assesses the nurse's current job plan and in the next 3 years. Example, what is your job plan for next year? And what is your job plan for the next 3 years? Perceived quality of care in general. This assesses the workload and quality of care provided to the patient. Example, the patient assignment was appropriate considering both the number of patients and care they required. Another question is, what is the maximum number of patients assigned to you? Meal breaks on unit last shift. It will assess the workload and its effect on the nurse's meal break on last shift. Example, what was the duration of your meal break? And are you able to sit down during your break? House schedules and extra hours worked by nurses. It assesses the number of hours worked by nurses in a shift and in the last 7 days, plus the reason for working extra hours. Example, how many hours did you work and why did you work extra hours? Through the eyes of the workforce. It assesses if the nurse is respected, supported, and recognized by other healthcare workers. Example, in my job, I am treated with dignity and respect by everyone. Quality improvement. This assesses the staff understanding of resources and quality improvement efforts that led to better patient outcomes or nursing work environment. Example, all nurses have access to recent NDN-QI comparative data report. After defining the meaning of each category of the survey, we will move on how to interpret the RN survey report. Each question is scored and each score has a mean, which is the benchmark. The benchmark is the term used for the targeted score we want to achieve. Hence, we will also have an overall score and mean or benchmark for some category. Now, let's choose a category to interpret. For example, under Nursing Foundation for Quality of Care, using the scale 1 to 4. Your unit scored 3.05. The mean is 3.09. It means your unit underperformed in this category. This result is a negative outcome for your unit, which means you need to start an action plan for improvement. A different view of this scenario is if your unit scored 3.14 on the same category and the mean is 3.09. This means your unit outperformed in this category. You may continue with your current practice, and if you aspire for excellence, remember there is always room for improvement. Another example under NDN-QI job satisfaction scale is RN to MD interaction using the scale 1 to 6. Your unit scored 4.50 and the mean is 5.16. It means your unit underperformed in this category. This result is a negative outcome for your unit, which means you need to start an action plan for improvement. A different view of this scenario is if your unit scored 5.16 and the mean is still 5.16. It means your unit outperformed in this category. You may continue with your current practice, and if you aspire for excellence, remember there is always room for improvement. Thank you for joining us. You can rewatch the video as many times as you want. If you have any further questions, please do not hesitate to contact your nurse managers, clinicians, CQI Link nurses, and NDN-QI site coordinator for more clarifications. Thank you again for being a mover for change, and always remember, your voice matters.